because of the view that you do not have to lose your teeth because you are aging. Hello everyone, once again this is Time with Your Dentist on Mba TV Ghana, and I am your dentist, Dr. Harry Boating. Today we are going to continue with a series on common dental conditions. So over the past few weeks we've talked about one of the most common dental condition, that is being tooth decay or dental caries, or caca like our local parlance we will say. Today we are going to look at the second most common dental condition or disease in our mouth, and that is where our focus will be on today. We are talking about disease that affects the gum. Now, when you open your mouth, obviously there are two obvious things that you see: the teeth and then the gum. The teeth is what we did talk about the last time, and so we talked about tooth decay, what causes the risk factors. We talked about the prevention and some treatment modalities. So today we are going to look at the second most obvious structure in our mouth, and that is the gum. Of course, when you open your mouth, you see this either pink or dark brown tissue or covering that surrounds the teeth. It's supposed to protect the teeth and serve as shock absorbers and all that. That is what we are going to talk about. So if you remember, in our first episode we did talk about the brief anatomy of the mouth, and we talked about the fact that the tooth is supported by certain structures, and we did talk about the fact that the gum is one of them, the bone where the teeth sits, and certain fibers or wires that connects the bone to the teeth, and then the lining around the teeth called cementum. So these are the supporting structures of the teeth that we'll be talking about today. Now, these structures can also be diseased or can have infections, and so today we are talking about gum diseases that we call gingivitis or periodontitis. That seems like a big name, but it simply means that inflammation affecting the gum or inflammation of the supporting structures of the teeth. Now, when I talk about the supporting structures, we are looking at the periodontal fibers, we are looking at the bone itself, and then we are looking at the cementum, that is the lining of the roots of the teeth. So today our focus is going to be on gingivitis, that is inflammation of the gum and inflammation of the supporting structures of the teeth. And like I said, this is the second most common dental condition worldwide. Now, gingivitis simply means inflammation of the gum, and so when under normal circumstances your gum is supposed to be pink, or we will say coral pink. Of course, some people have dark pigmented gums. That is normal, and so that is a normal color of our gums. But if you are having gingivitis, or the gum is diseased, or the gum is infected, there's an infection going on in the gum, these are some of the things that we want you to know about, so that when you're experiencing them, it will bring your attention to the fact that there's something not going right with your gum. The first thing you see is that when you brush, you see blood, or you bleed on brushing, and so even you convince yourself that you are using the softest of brushes, yet when you put this brush in your mouth, you see blood coming out. The blood is a sign that the gum is inflamed, or there is some um, infectious processes going on in the gum. And so that is the first sign that you see as a patient. The second thing is that you see that the gum will be, if you have a, normally if you had a pink gum, your gum will be a bit reddened. That is, and this is not painful. Most of the time, this is not, will not come with pain, and because of that, most of us will not attend to it because there's no pain, and that is an attitude we all have. But that shouldn't be the case. The moment you see any color change in your gum, that you normally you have a pink gum or dark gum, but all of a sudden the gum has become reddened than usual, it should bring attention to the fact that there's something going on. The second thing is that the gum will become a bit bigger or swollen than normal, and so you have in between the teeth, you have these swollen pieces of gum in between the teeth. That is not normal. And so, if you look into your mouth and you see some of these things, it should bring your attention to the fact that there's something going on that is not right. And it's to tell you or inform you that it's time for you to see the dentist. So, I've talked about two things. I've talked about the fact that there will be bleeding when you brush. So some people will come, when I spit, I see blood. When I brush, after brushing, I see blood in my mouth or in my brush or in the sink that I use. The second thing is that you see part of the gum being swollen, especially in between the teeth. You will have these gums swollen in between the teeth, and that should inform you that there's something going on. Of course, when you're having blood in your mouth, when you're bleeding on brushing, and you have all these, it will not give you pleasant smell. So the third thing is that you obviously will have a breath, bad breath, and that is a contributory factor to most of us having bad breath. So basically, that is what you see with gingivitis. It will not purely present with pain. It will not purely present with pain, but these are some of the signs that when we look out for, we can easily pick out the fact that there's something ongoing in our gums. Right, so I have gingivitis. I do not do anything about it. What happens? Now, let's me say that gingivitis untreated, if you do not do anything about it, will progress to what we are going to talk about, to affect the other structures supporting the teeth. And so you have your gum, the body will try to fight the infection. um, the infections, or that we talked about, the fact that you have um, dirt in your mouth, bacteria in your mouth, and all that, the body will try to fight it. So there will be series of inflammation. The inflammation is what we see as the gum getting bigger, getting swollen, and the color changing and becoming more reddened. So those are all signs of inflammation. The body is trying to fight the infection that is in your mouth. But of course, once the irritating factors or what is causing the infection is still there, the body will try as much as hard as possible to try to get rid of the infection, but then it will not succeed because the irritating factors are still there. What do you need to do? Until those factors, irritating factors, are removed, then your gingivitis will persist. Now, if the gingivitis persists, it progresses to affect the other structures of, or the other supporting structures of the teeth. And so here we are talking about the periodontal fibers that we did talk about the last time, the bone itself, and then the cementum. And that is where we have periodontitis. Periodontitis. Now, we'll talk about periodontitis at another session, but here let's focus on gingivitis. That is disease of the gum that we started with. Now, someone will say, what causes this? Primarily, or fundamentally, or basically, the cause of inflammation affecting the gum is when you have what we call plaque. Now, plaque or calculus. Now, if I can say, if you've never visited a dentist before, or because of COVID, most of us were scared of the dental office. So maybe for a year or so, you've not seen a dentist. When you open your mouth and you look, especially your lower front teeth, underneath your lower front teeth, you see that these um, whitish, chalky whitish material that is attached to the base of your teeth. Sometimes they look yellowish, brownish, and sometimes dark in color under your teeth. I'm sure we will show pictures of that. And so, this adherent mass and called plaque or calculus, it is made up of bacterial species. It is made up of what we call polysaccharide matrix. That is quite a big word, but it's just a matrix, and then it's also made up of the food debris. So, and then calcium. All these come together and form that mass under the base of our teeth. And because it is not part of our body, the body sees it as a foreign material, and that is how come the body tries to fight it, because it is not part of us. And that mass is full of bacteria, and this bacteria releases their toxins and starts the whole inflammatory process. And so once you have this in your mouth, then definitely you will have what we call the gingivitis, or infection or disease of the gum. So, what do we do? I always say that no matter how well you brush your teeth, no matter how well you keep your mouth, as far as we are eating, you have this build up in your mouth. So it's no fault of ours that you have it, because once we are eating, there's no way you can 100% completely get rid of all the food debris. No. So as you eat, you have a little amount of the food debris in your mouth. It's like keeping water in bottle for a long time. If you get rid of the water, you see this little amount of sand left there, and that's how it is. So over time, this comes together with the bacteria already in our mouth. The food debris comes together with the bacteria already in our mouth because of saliva. Saliva contains a lot of calcium, and we have a lot of calcium in our mouth. So this comes together and forms this adherent mass called plaque, and that forms at the base of our teeth. And so when you find that it is the primary cause of gingivitis, of course we have other causes, but I'm saying that it's the primary cause of gingivitis and periodontitis, which we'll talk about at another time. So we have a lot of causes aside what I've spoken about. So we have gingivitis caused by other systemic factors, for example, pregnancy, people on oral contraceptives, other medications, antihypertensives, antidepressants. All those medications can cause some form of gingivitis. So we have drug-induced gingivitis. We have gingivitis induced by systemic factors. We have other non-plaque induced gingivitis. So you're talking about viral, fungal, all those causes are there. But I'm saying that primarily, gingivitis is caused by plaque, and that is what we can deal with. That is what we can deal with. Unfortunately, this plaque that I've talked about cannot be removed by brushing. So you cannot use your brush to remove that. I've had funny incidents where some clients come to me and they try to remove it, and one actually, when the husband went as far as taking a kitchen knife to try to get rid of it, and ended up lacerating or cutting the lip of the wife. That is how far some people want to go to remove those things. But it's so simple. So we are talking about prevention. How do I prevent this? Like I said, once you are eating, the food will build up. Food will remain in your mouth. Once food remain in your mouth, calcium is there, bacteria is there. They'll form an alliance, or they'll come together and build it up. What do I do? It's simple solution. Visit your dentist, let them have it removed, and that is what we call cleaning or scaling up and polishing. It's as simple as that. So we advise that, if at worst, visit your dentist once a year. Ideally, it should be once every 6 months, so that when you have these things built up in your mouth, we can easily remove them. And I can say on authority that if you have these things removed, then your incidence of having, or your risk of having dental decay will be very, very reduced, so that you do not have to worry about having your tooth decayed and having gum issues. And of course, we talked about the prevention. The same thing. You eat well. You try and reduce, or if you can stop in between meals snacking. We eat healthily, more vegetables and fruits that we talked about the last time. You try and exercise if you can, and all these simple things actually help reduce this build-up or plaque that we are talking about. But fundamentally, or what is very important, is that let's develop the habit of visiting your dentist. You do not have to be sick. You do not have to be down before, or be in severe pain before you visit your dentist. But diseases of the mouth are progressive. It starts as non-painful process, and then it goes on. If you do not do anything about it, it gets worse and becomes painful. The point at which it gets painful means that it is well advanced, and that is not where we want to get to. We want to catch it as early as possible, so that whatever we have to do, we'll do to help our patients. We want all of us to smile beautifully, so that we do not have to lose our teeth at any point in time. I'm always of the view that you do not have to lose your teeth because you are aging. No, aging does not necessarily mean that you have to lose your teeth. And I always say that if you lose your teeth at a certain age in your life, it simply means that you did not take good care of it, and that is how come you are losing. So losing aging is not synonymous with losing teeth, not at all. It should rather be the other way around. So if you take good care of your teeth, I can guarantee that the number of years that God has given you, you go with your teeth. And that's what we all want. We want to smile from beginning to end. We want to have a pleasant smile for everybody, and that is why we are here to educate to us on how best we can keep our oral hygiene for the good of all. Having a healthier world means brushing twice daily, and that is what I want to leave you with. Let's brush twice a day, so that we can keep our mouth healthy. Let me also add this: having a healthier world also means that getting or eating less sugar, and all this, we talked about it the last time. As much as possible, we want these sessions to be interactive. We want to educate our viewers. So if you have any question, I said anything that you need clarification on, anything you did not understand, whatever that bothers you concerning your oral health, kindly leave your questions at the comment section, and we will address it. We want this to be interactive as much as possible. So on that note, kindly subscribe Mba TV Ghana for more educative sessions like this. Thank you, and till we meet again next week, take good care of yourself.